It's week 4 of 2022. I'm Smitha Nair. This is your weekly fix. Most people who suffer from COVID make a full recovery, but a significant number of people face prolonged symptoms that cannot be explained by an alternative diagnosis, symptoms that can be debilitating. A few days ago, the World Health Organization reiterated an earlier warning that countries and governments should not ignore long COVID, and that it will continue to work towards recognition, better research, and appropriate rehab for those suffering from post-COVID-19 condition. But many COVID long haulers across the world say that their conditions, which don't necessarily present in one particular way, are very often dismissed by doctors and researchers. There is growing frustration among this cohort over the lack of dedicated documenting and research. And when it's happening, patients, many of whom advocated for long COVID to be recognized, say researchers aren't really listening to them. What has the experience been for COVID long haulers in India? Health journalist and editor-in-chief of Suno India, Padma Priya, has spoken about how long COVID can be an isolating and lonely experience, and there still is, inexplicably, shame and stigma attached to it. Padma Priya is also the founder of India COVID Survivor Group. She joins us on the podcast. Thanks for making the time, Padma Priya.
Thank you, Smitha, for having us here.
From the limited documentation available in the public domain, I understand that for those who experience long-term effects of COVID, it isn't partial to any one organ. Although the virus primarily attacks, or attacked in the case of earlier variants, the lungs, documented cases of long COVID shows kidneys, blood vessels, intestines, heart, the hormones, the brain, the eyes variously being impacted. Could you give us a first-person account of how weeks, months, and now more than a year after your negative report, an average, otherwise healthy young person in her prime, COVID has changed your life adversely?
Sure. Again, thank you so much, Smitha, for having me on the podcast. So it'll nearly be 2 years this April that I got the first time that I got infected with COVID. I've been infected with COVID twice, once in April 2020 and second in April 2021, unfortunately. My life has changed in ways that I could have never imagined. It has changed. It's been a traumatic few months for me, physically and emotionally. And I think the more difficult part is that doctors doctors in India, I can at least say, are yet to catch up with the science that is quickly evolving around the world around long COVID. There have been very few and not very intensive, I would say. Few and far in between, I think I would say, in terms of even research that's coming out from India about long COVID. Just personally speaking, for me, how it has changed my life is that I now have a condition called as POTS, which is postural orthostatic hypotension syndrome, POTS. It's falls under the larger umbrella of dysautonomia, which is when the autonomic nervous system starts to dysfunction. The autonomic nervous system, just for the listeners to understand, is the part of your body, part of your nervous system, which regulates temperature, which regulates heartbeat, blood pressure, digestion. So a lot of the critical things are regulated by the autonomic nervous system, and it is autonomic in nature, as in it's very automatic. And so for me, I now have a dysfunction in this system, which means that I cannot go long hours without feeling faint if I sit for long. I also have been diagnosed with chronic fatigue syndrome, CFS, or it's also called as ME, myalgic encephalitis, ME-CFS. And now and doctors are also suspecting an autoimmune disorder, so they're yet to figure out which one. So even as I speak, a couple of my diagnoses are pending, and I still have inexplicable symptoms. On an average day, I have anywhere, I can only work for maybe 2 or 3 hours, and that's on a very good day. On my really bad days, I am bedridden. I cannot really do much. I'm extremely fatigued. My blood pressure fluctuates. I cannot walk a lot. I cannot sit for long. So yeah, it's been pretty hard for someone like me who has been pretty active otherwise, and in fairly good health. I mean, I've never had any major chronic issues apart from say migraine. I mean, and so yeah, this has been really really hard for me to even comprehend and to live with. And with a young child at home,
Yes.
there is also that whole guilt of, am I being a good mother? And oh my God, like, you have all these conflict emotions that come on. So yeah, that's how my life has changed.
And despite that, it is truly remarkable, the advocacy work you've been doing for so many months now. You're an experienced health journalist, Padma Priya, which I would argue makes you better placed than an average patient, in that doctors are less likely to dismiss your concerns. You have access to people in the healthcare ecosystem. I want to ask you if you have at any point felt gaslit by doctors, the fight to be believed, to be taken seriously by doctors, even family in some cases, it appears is real.
All the time, Smitha. All the time. And I don't think like being a health journalist actually helped me in that sense. Maybe to some extent, but not more from being a health journalist, but because I worked as an advocacy person for MSF prior to starting Suno India. I also know sort of the approach that doctors have towards chronic illnesses. But yeah, I think the first few months my diagnosis was delayed because I spent days, weeks, months trying to make a cardiologist believe that I was having this problem. And she simply refused to believe it and signed me off as someone who with anxiety and prescribed supplements and so on. And it was only again, okay, I think the health journalist networks definitely helped me. And that's where, I found a very good internal medicine specialist in Hyderabad
Okay.
who decided to run some additional tests and found out that I had very abnormal levels of norepinephrine and epinephrine, which are basically, um, you know, adrenaline hormones. And, he was like, oh, this is really abnormal and this shouldn't be so high. Um, and I spent another nerve-wracking week wondering, if it was waiting for a diagnosis, if it was actually an adrenal gland tumor, and it turned out to not be an adrenal gland tumor. And that's when he realized that there was something off and sort of explained to me that my body was stuck in a fight and flight response and it was still fighting. It still thought that the virus was in my body and fighting. And I'm talking about September of 2020. This is, the April I got, end of April, I got COVID, recovered by May. So this is September 2020 when I finally got one little clue or one little hint into what was happening, because of this one doctor who was mindful and who chose to sort of see what more was happening. And I think he was seeing more patients coming after COVID with similar sort of complaints.
Okay.
So yeah, I think for my diagnosis got delayed because I was gaslit. But even after this, I had to go for neuro consults in because my condition worsened in January, February of 2021. And I was hospitalized in March 2021 just because I was just fainting every time I stood up and I was barely able to walk. And they decided to admit me and run some tests. And after that, I had to go. I was actually referred by the same doctor to another neurologist, in a semi-government setup in Hyderabad. And yeah, I mean, everybody somehow thinks that if you are a woman, you're either being hysterical or you have some, you're having severe anxiety. And I was repeatedly told that it's probably that. I also underwent. I'm not saying that anxiety cannot cause these problems, but to just attribute anxiety as a first diagnosis is the problematic issue that I have.
Hmm.
So yeah, I have been gaslit, not by one, not by two, but multiple doctors and multiple psychiatrists, and it's not it that has only added more to my distress than helped me in that sense. There have been instances where I've actually had to push back and tell a doctor that I'm here in front of you because I'm asking for help, and having to remind them this one doctor commented on my weight. His first instance was, you need to lose weight, when I am going there for dysautonomia symptoms. And I just looked at him and I said, I waited 2 hours, despite having very less energy, and I'm here to seek your advice, and I don't need this advice. Like, if you can, I actually had to also give it back. So
Wow.
having to learn to stand up for myself, in an equation where, because whether you're a journalist or not, the equation when you enter a doctor's room is that of a doctor and a patient, and there
Yes.
is power imbalance. There is there is obviously this whole, and we've been brought up with the conditioning is that doctors know it all. Um, and for me, it was very distressing to see that doctors were not catching up on research. I've actually had to send research papers to some doctors and tell them to catch up on read on the latest research around dysautonomia and long COVID. I mean, it shouldn't come to that point. And funnily, I've had one doctor ask me to summarize the research paper when I went for a consultation, because the doctor didn't have time to read up. I mean,
Wow.
you should not be asking a patient to summarize research findings. So yeah, it's been pretty frustrating 2 years. I can tell you that. Yeah.
In your understanding, and I know you've spoken with a number of people suffering from long COVID over the months, is the disbelief mostly when the long term effect is not measurable? Like pain or fatigue that doesn't show up on tests, or something that is invisible, like, say, rashes? And also because long COVID itself is nebulous, ill defined, non specific, some people say. Is that why some clinicians seem to talk of this as being more psychosomatic?
No, actually, no. In fact, I mean, like you said, I run founded the India COVID Survivor groups, and we are close to 400 people in there now. Couple of us are very active, and we do share often what's happening. And my understanding is that even when there are very specific symptoms like increase in heart rate, tachycardia, or bradycardia, decrease in heart rate, or drop in blood pressure, or even something like recurrent headaches. Even those are being attributed to psychosomatic symptoms. um, I had one person who said, not from the group, someone I know, tell that, again, he was dismissed because he was overweight, and later found out that he got diagnosed with a thyroid condition that came because of the onset of COVID. After COVID,
Okay.
he got it triggered something in his thyroid, and there was some dysfunction in it. And initially, he was dismissed as, kuch nahi hai, you're just overweight, lose weight, and you'll be fine. The other thing is that I feel like doctors in India have not caught up with research, and they are not really understanding. Maybe, and I think now maybe some doctors are. I mean, at least my recent visit to a rheumatologist, though it was a bit whatever. I mean, anyway, I mean, it was fine, but at least they were mindful, and they said, oh yeah, we are seeing a lot of patients with post-COVID joint pains, post-viral joint pains and stuff like that. But my sense is that overall, doctors need to catch up more on the research. They firstly just need to listen to your patients and stop dismissing them as having anxiety.
Hmm.
So no, it's actually, even if there are indicators, they are patients are being turned away, patients are being given supplements, or they're in fact being put on anti-anxiety meds without being informed that they're being put on anti-anxiety meds. I had someone who sent a prescription to me saying, this is what my doctor prescribed, and I asked, do you know that this is an anti-anxiety medicine? And he said, no, I didn't know this was anti-anxiety medicine.
Hmm.
I mean, that's just, to me, very unethical. How can you prescribe meds and not tell them that it's an anti-anxiety medicine that you're prescribing to a person, or being given supplements? So there are a mix of factors, and for why maybe doctors are not catching up on it, I feel they're burnt out. It's this pandemic has gone on for way too long. We already have a healthcare system that's so stretched. Um, but I still feel somewhere their responsibility does lie in trying to find answers for the patients. So yeah.
I can only imagine the mental health impact of continued physical manifestation of long COVID, aggravated by the denial that something is really wrong with you. And add to that the out of pocket expenses. It's not cheap to continue going for these follow ups.
No. No, and it's not everybody can afford this. And I remember, I think a few months ago, Scroll had written an article about what was happening in the tier two and the rural pockets of India with regards to post-COVID. I think one
Yes.
of the few publications to have written about, even get a story from not the metros, and that should be our worry. I again had spoken to somebody who is sitting somewhere in the interior part of in one of the districts of Telangana, and this person has been having post-COVID effects for the past year and a half, and he's made multiple trips to he and his wife both have these symptoms, and they have made multiple trips to to Hyderabad just to get certain tests which were not available in their district. And they have spent a lot of money, and they're not like super rich or anything. I mean, they're normal middle class people, with farming background. So I don't even want to think. I mean, it's for me unimaginable what's actually playing out in the smaller towns where the awareness is much more lower.
Yes.
The understanding is much more lower. There is limited to no government intervention with regards to post COVID. And yeah, with regards to out of pocket expenditure, I think this is the most common thing that we discuss in even in the support group, is that how uh, we are spending so much money out of our pocket, just trying to get some answers, and oftentimes we don't get the answers. Oftentimes tests come back with with sometimes no results, or having to undergo regular MRIs and CT. Like I have a there are changes happening in my brain, and I need to get regular CTs and MRIs, and they're not cheap. Yeah, it is. I at in April 2021, when I got COVID again in the Delta wave, because I was already immunocompromised and everything, I ended up landing in the ICU, and that burnt a big hole in my pocket. I ran out. My insurance got exhausted. I pretty much have spent all my savings in the last 2 years. The family savings are gone. We have had to start from scratch. I'm fairly okay privileged. I at least had friends who were there who could lend me money and help me tide the financial crisis that we had entered into. Um, but it's not the case for everybody.
Hmm.
I know people who have put off tests, who till date are not able to get tests because they can't afford it or their insurance doesn't cover it. I myself have put off a couple of tests because of the same reason, and because the maybe the only place it's available is, say, a CMC Vellore, and how am I supposed to travel with my immunocompromised body from Hyderabad to Vellore? So it's really frustrating situation to be in.
Yes. Padma Priya, do we yet have any measure of the numbers? What does your research and your experience tell you about post COVID OPD's data collection? Most people, you said, can't afford the costs of follow ups or tests needed, and post COVID OPD requires self reporting. It's not as if hospitals and researchers are sort of following up proactively. I remember reading an interview with the ICMR chief last year where he had spoken about 15 mentor hospitals and the role they will play in this sort of data collection.
Not in India. I don't think that there is any sort of data collection mechanism currently happening in India. Also, the fact remains, as we all know, that we also have, so our healthcare in itself is so fragmented. You have so many people seeking care in the private sector, versus the government sector. So I don't think that there is any sort of centralized monitoring happening. Though I think it was supposed to have happened. I remember. A Ken article about this, that they were going to set up something where they would centralize data collection on post COVID. I doubt that's happening. these 15 mental hospitals that you mentioned, I don't, I mean, a lot of us in the post COVID, in the long COVID group, we wouldn't even know how to access these hospitals. How we, like, they don't seem to be even talking, saying, come here if you have XYZ symptoms, we will give you care. Like,
Hmm.
the government is not even saying that, like, so data collection, from my understanding, is limited to no. And in fact, I am trying to see if we can do like a patient-led survey, like Body Politic did in the US, and put out their research paper sometime in mid 2020. It was sort of almost, the one that pushed the research forward in terms of long COVID. So, we are in fact talking within the group if we should start a patient led survey where, we'll reach out to like-minded doctors and ask them to partner with us and do something, because none of us we don't have that kind of research expertise. We can probably do a survey form and everything, but reading it and analyzing it, and
Right.
yeah, then again there is people saying, oh no, but like, somehow there's this whole thing like, oh, Indians are getting better faster. But what is the proof behind these kind of claims? Like, I would really like to know, if that is the fact, then there needs to be some sort of, for example, today in the Guardian, an article came about a paper in which it said that people who have asthma have certain markers, biomarkers, which, if identified early, after they get COVID, if identified early and treated and caught early, um, it can actually prevent them from going and developing long COVID. So, do we even have any such kind of research? There is research coming about microclots causing long COVID. What is even happening about this in India? I mean, this is there is nothing concrete really coming out. The only thing that came out, again, I think this was a article in a leading newspaper today, and you we had a AIMS assistant professor of AIMS, talking about a post COVID study, and then at the end saying that it's also because of psychological issues that some of them go on to develop long COVID. No, that's not the case. And we've had one of our patient, I mean, one of our group members call him out on that. And it's like, please catch up on, I would be first very happy if they catch up on the research. Then, if the government can actually institute a large scale, okay, at least within these 15 mental hospitals, institute a large scale survey, start doing surveys among people.
Yes.
Whatever little surveys have come out have also come out from private hospitals like a Fortis, or somebody else, and it's very small cohorts. We need a large scale survey at this point to even understand what's happening within the Indian population about after they are hit by COVID. How many people are actually not getting the help that they need? Women are experiencing menstrual changes, which is lasting anywhere between 3 to 6 months. And this is not being tracked. I mean, I was told this by my gynecologist that she is getting a lot of women who are coming after recovering from COVID and their periods are not normal. Who is tracking all this? I the rheumatologist is very casually telling me, yeah, we're seeing a lot of patients with post-COVID rheumatitis, rheumatoid arthritis, or inflammatory arthritis. Again, who is tracking all this? Like, it's just going under the radar, Smitha. I don't think that there is any data collection happening at this point, and whatever information we are getting is very almost anecdotal, to say that, to say the least.
Yes. While we may not know the exact numbers, one can perhaps extrapolate from research and surveys published in countries like the UK and US, and it is not a small number. What is perhaps also not spoken about in all this is the productivity loss, the economic cost.
Like, for me, it's like the magnitude of this problem is so huge, if in India. And what we're looking at is actually a mass disabling event. That's what a lot of people are talking about long COVID. For months together, we are unable to work, we are unable to go back to work. Even if we do go back to work, our productivity level is so low because we are having cognitive difficulties. Today is my good day, I'm not having brain fog. Otherwise, I probably would not have spoken to you in this candor, in this way. I would have struggled to even find words. Some days are like that for me. So, yeah, so look at this from also an economic perspective, because there is going to be an economic fallout of long COVID, and other countries are starting to realize that. Like, in the US, you have gig workers getting, not able to get back to work at all because of this. We have doctors with long COVID who are unable to get back to work. So I think Indian government really needs to wake up and look at this as even as a HR, as a, as a human resource problem, as an economic problem, apart from it being a huge public health problem.
Padma Priya, is there a call to action appeal that you have to share?
I'm part of the board of advisors of Dysautonomia International, which is an organization based in the US, and they've been advocating on dysautonomia and related conditions for the past decade or so. And I'm now part of their board of advisors for the Long COVID Research Fund that got launched yesterday. So that's January 25th. And this is an international fund, and essentially, um, people who researchers who want to do research on long COVID and dysautonomia can write proposals and submit to this fund, and this fund would be able to, depending on obviously the merit of the proposal, would be willing to fund such kind of research. So, if there are any, I'm sure in your listeners there will be policymakers, researchers, doctors listening to this. I would really urge you to look this fund up. So it's called the Long COVID Research Fund by Dysautonomia International. And I can share the link with you, Smitha, if you can add it maybe in the show notes.
Yes.
I would urge people from India, scientists, researchers, doctors, to look this fund up and maybe submit some very good proposals so that we get more research from the country. Because this is an international fund and it's not limiting in that sense. So, yeah, please, one of the common things that I again hear, Smita, from doctors that I'm speaking to is when I tell them why are you not doing more research, is that they say that there's very limited funding available in India. So I really want them to take the opportunity of this fund and see what they can do best to support to support patients, to help patients, because the treatment should have been found yesterday, literally yesterday, and we're already 2 years into this pandemic with people dying, with people getting disabled, with people falling, getting long COVID. So yeah, I do hope that also more funds like this come up and more people come forward and organizations come forward to do research into this.
Thank you. Thank you so much. Thank you for making the time, Padma Priya.
No, thank you so much for doing this, Smita.
Thanks also to our listeners. I'll be back next Friday.